Hey there, I'm not P.A. Bennett, obviously. I'm Trey Taylor in for P.A. Bennett, but we're still going to have a great show for you. We actually have 3 great guests for you this afternoon, and we're going to cover abundance of topics, including the holidays and what you need to do to get ready to get your taxes done, because it is the season not only for the holidays, but definitely to get your taxes done. Plus, later on, we're going to talk with Karen Alexander with the Auntie Karen Foundation. I want to find out everything that's going on with her foundation and the resurgence of the Legends of Concert series. But first, Dr. Nicole is in the studio. She's with Abundant Life Concierge Service. We're going to talk more about her innovative new practice. But also, Nicole, we want to talk about the new blood pressure guidelines. First of all, good afternoon. Thank you so much
there,
for joining
Trey.
us.
Thanks for having me. Appreciate
Absolutely,
it.
absolutely. So now, the American Heart Association came out with these new numbers first thing this morning, and this means that over half of Americans now have high blood pressure.
Absolutely, absolutely. So from 36% with the old guidelines to now we're at almost 50% with the new guidelines.
Wow.
So the old guidelines said that anything above 140 over 90 was considered hypertension. You were pre-hypertensive between 130 and 140 and between 80 and 90. We've gotten rid of pre-hypertension now, so now you just have either you have it or you don't. You have it or you don't.
So what happened that the guideline, they done changed the start and the finish line, girl?
They did. So actually, we've always known that the risk was there. And the risk is still there even with just the elevated reading. But now we're understanding that with that elevated reading, there's even more of a risk. And the risk includes hypertension, uncontrolled hypertension, which can lead to heart attacks, strokes, kidney failure, blindness, and death imminently.
Wow. So now, what does that mean? Now, it's 130
over 80 is the new guideline.
80. So if you already had high blood pressure, you just keep taking your medicine.
Well, you keep taking it, but what it also has changed is the way that doctors treat it. So before, if you came in my office and you had a 130 over 80, I might wag my finger at you and say, hey, we need to really, maybe do something, but I wouldn't necessarily put you on medicine or change your medicine. Okay. Now you come in with the 130 over 80, I'm going to have to do something about it.
So people need to go back to their doctors or at least go somewhere and get your blood pressure checked.
And we're not saying that you have to come into the doctor and get it checked. You can go to the pharmacy and get it checked. You can check it on a home machine, but you need to be checking it. And if it's over 130 over 80, you need to go see your doctor.
All right. So if I come to you because I've gone and gotten a blood pressure machine or gone to the drugstore or somewhere, gone to a doc in a box, and now it's 130 over 80. So now what do you do?
So first thing we're going to do is we're going to start with prevention.
Okay.
So we're not just going to throw medicine at you. People think, oh, doctors just want to throw medicines at you. No, we don't. Believe me, we don't. But we're going to start with lifestyle changes, and we're really going to hit hard on those. So limiting your sodium, increasing your water intake, making sure you're getting 30 minutes of cardiovascular exercise, which can bring down your blood pressure 5 days a week.
Now, let me ask you this. Is it 30 minutes per day?
30 minutes per day. It doesn't have to be 30 minutes at one time,
okay,
but 30 minutes per day. So you could do 10 minutes, 10 minutes, 10 minutes, but 30 minutes per day, 5 days a week.
Okay, so what is that? Okay, 30 minutes of cardiovascular. Does that mean walking?
Walking is included. Anything that gets your heart rate up above your resting heart rate. So yes, walking, jogging, elliptical machine, hiking, swimming, dancing, Zumba.
What about I've got a stationary bike that I get on regularly.
A stationary bike. I even have for my patients that have bad knees, I tell them to get the bike that sits on the table and you do your arms. And you do your arms for 30 minutes, it gets your heart rate up. It's still cardiovascular exercise.
Okay. Do you also recommend, because I do this a lot, and I know doctors, physicians suggest that you park far away so that you can kind of walk further to your destination, that you take the stairs?
Take the stairs, park farther away, absolutely. Those are the little things that we can do. Take a walk around the block when you get home. It doesn't have to be, like I said, 30 minutes all at once, just wherever you can find it, but make sure you're getting at least 30 minutes in where your heart rate is getting up.
Right, okay, so 30 minutes of exercise, 5 days a week. The other thing you said that I wanted to mention was sodium. Of course, that's salt.
Right.
So, girl, I love my French fries. I love potatoes, French fries, baked potatoes, sweet potatoes. I love fries. I love potatoes.
Yeah.
So do I just have to eat potatoes and that food?
Potatoes without the salt. You know, there's other seasonings that we can use besides salt. So, you know, garlic, not garlic salt, not onion salt.
Right. Garlic powder.
Garlic powder, or even the fresh vegetables, fresh spices. You know, your basil, your thyme, your parsley. Yeah, your garlic. So, but you want to limit your sodium. There's a sodium in places that we don't even know.
I was going to mention that.
Yeah, so things like canned vegetables. Anything canned is preserved in sodium. Even your packaged meats, preserved in, so you know that liquid that comes like in your ham, that's sodium. That's what they use to preserve it. That's why when you go and you get it sliced at the store, it doesn't last as long as the one that lasts in the bag. Because it has all that sodium in it.
All right, so then what does that mean with our canned vegetables and our packaged meat? Does that mean you should wash it off?
Wash it off, or buy the ones that say limited sodium, or try and go fresh, or frozen if you're going to use a vegetable that's already prepared.
Okay, so frozen is better for you than canned.
It's better than canned, absolutely.
Okay.
Yeah.
All right, so exercise, cut the sodium. Anything else we need to stop eating to help minimize our blood pressure?
You can limit the amount of alcohol you're taking in, and of course, stopping smoking. That's a really big one. But in terms of food, sodium is the really big one. There are, like I said, certain foods. Some of the shellfish, things like shrimp, have more sodium than other shellfish. But you can just check with your doctor or nutritionist about the specifics.
We're talking to Dr. Nicole Edwards with Abundant Life Concierge. We're talking about the new blood pressure numbers that came out today. It says that if your blood pressure is 130/80, now you have to be more conscientious because you have high blood pressure.
Absolutely.
So Nicole says, first, make sure you know what your blood pressure numbers are. That could mean just going somewhere and finding out.
Right.
And then come to your physician.
Absolutely.
Now, you said that we should definitely exercise 5 days a week, 30 minutes a day. Stop drinking. Now, is that everything? Beer, wine, LIKKA? Is everything?
Well, the hard liquors and liqueurs are going to be a little bit more, but yeah, you want to limit all of your alcohol intake.
Wow, all the time?
Not all the time. Just limit,
just
not stop. Not stop, but just limit. You want to lower your amounts, within moderation.
Yeah. What is moderation? Nicole, can you have one drink a day?
You can. For men, yes, you can. It has to do with the size of the drink. So it depends on what size you're talking about. Are you talking about a 40 ounce? No, that's a little too much.
Yeah.
No. But a small drink, 1 glass of wine is actually more beneficial to the heart. But your beers and your liquors.
That's the thing, girl. That's the thing. There's the little Jedi mind trick. They tell you to drink wine because it's good for your heart, but you can't drink wine because it's bad for your blood pressure.
Well, not so much the wine. The wine is okay for the blood pressure and the heart in moderation. It's the liquor and the beers that you're wanting to limit.
Okay, and then you say stop smoking.
Stop smoking. Absolutely. We know that smoking is the number 1 cause of preventable death, and then blood pressure control is the number 2 cause of preventable death. Yeah.
Now, the other thing that we talked about that is always mind-boggling to me is sleep. The amount of sleep you get has a huge effect on your health.
It really does.
Your blood pressure. Tell us about that.
It really does. So sleep is where your body resets, okay? So if you're not getting sleep and those cells are not resetting and your body's not resetting, your muscles are not having a chance to relax and reset, then everything is always on overdrive. Everything is more stressed, more tension, more tighter, and it doesn't have a chance to reset and re-stress. Your heart is a muscle, and so just like any other muscle, you can tire it out. We don't want to tire out your heart.
Right. If you have a question, you can call 803-733-5620. That's 803-733-5620. We're speaking with Dr. Nicole. She's with Abundant Life Concierge. We're talking about the new blood pressure guidelines. Now, if you have 130/80, you have high blood pressure, so you need to first, as you say, Nicole, you would suggest as a physician some lifestyle changes.
Absolutely.
And that's what we've been talking about. Exercise, limiting your drinking, eating less sodium, and of course, as you said, that means salt. So we will be conscientious about not using salt, and that means garlic salt, anything that has salt.
Salt, anything that says salt.
Yeah, use a powder instead, or like you said, some of the more natural herbs and spices.
Right.
And then, of course, smoking and sleeping resets. Now, I know for me, I always said I'm very nocturnal. and it takes me everything I can to go to sleep before midnight. I mean, girl, I'm up at 2 o'clock in the morning like it's 2 o'clock in the afternoon, going full speed ahead. But then I got to get up at 7 o'clock in the morning. So theoretically, I'm not getting.
You're not getting enough sleep.
8 hours of sleep.
Exactly. Now, those 8 hours of sleep, they don't always have to happen all at night.
Okay.
So as long as you're getting those 8 hours, if you're taking a nap and your body's getting a chance to reset, then you're okay. But you want to aim adults for 8 hours, 8 to 10 hours.
All right. I think we've got a telephone call. I think Dietrich's in there. Hello, you're listening to the P.A. Bennett Show. This is Trey. Okay, thank you so much. I know you don't have it. She wanted to know about how much sleep is really needed and how many hours, 2 or 3 hours, or how many hours does it take for the body to regenerate is what she asked.
More than 2 or 3 hours, I can tell you that right now. Really, it actually depends on your age. Okay. So the older we get, you actually can need a little bit less sleep, honestly, until you reach your senior age. But it's way more than 2 to 3 hours.
What is your senior age, girl?
Above 65.
Okay.
At over 65, we start to see what's called an infantile sleep pattern. So just like a baby doesn't sleep all night, they'll take a 2-hour nap, and then they're up, and then a 2-hour nap. You actually start to see that as we get older in age. So actually, more over 70, 75, we start to see you sleep less hours at night, more hours during the day.
All right. So do you need to do, because you said you don't have to get all the 8 at the same time.
No, you don't.
So do you get 4 and 4? I mean, does it matter how you break up that 8 hours?
I mean, if you can get 4 hours during the day, more power to you. But most people can't get 4 hours during the day. So it's best to get as much as you can at night and then get what you can during the day.
All right, we've got another call. Thank you so much for calling the P.A. Bennett Show. This is Trey Taylor. Can we help you? What time? Okay. Oh, okay, thank you. She wants to know what time. That's what you're asking, right? What time does the body regenerate?
What time?
What time in the morning? Is it 2, 3, 4?
It's not a set time. It's not a set time. It's that REM sleep is where you get into the deep sleep where your body's going to regenerate. Okay. So whenever you get that.
Okay.
Because, shift workers, they're totally off in terms of they get their sleep during the day. So it's not a set time of day. Okay. It has to do with when you enter into your REM sleep.
Okay. All right. So basically, you're saying you've got to get 8 hours of sleep, kind of like you're getting your 5 days a week, 8 hours of exercise.
Exactly.
You need to get in when you fit in.
Get in where you fit in.
Okay, because I thought you had to get 8 hours straight. So
here's the thing: the way that the REM cycle works, you're not in a REM cycle of sleep the whole time. Okay. So it takes some time to get into your REM sleep. You have your non-REM, you got a pre-REM, and then you're in your deep REM. And then you coming out. Mm-hmm. So if you're only sleeping 2 hours and then 2 hours and 2 hours, you're probably not getting much REM sleep. So that's why they say try to get, a good 5 to 6 hours at a time. And then if you need to take a nap to just kind of regenerate, then you can do that.
And going back to our caller's question, it's not a certain time of day or night when you get it. You just get it when you get enough sleep.
When you get enough sleep,
okay.
Yeah. And 2 hours is not enough. Not enough to get into that deep REM sleep.
Now let me ask you this, Nicole. You've got to do all of these together to really affect your blood pressure. Is that correct?
You really do, but we didn't even get all of them.
Right.
One of the other main ones, stress reduction. And in this day and age, we are all stressed. Yeah. And so when you're stressed, that puts stress on your vascular system, your cardiovascular system, on your heart, and that raises your blood pressure.
And we have several stressors: our jobs, our families,
our children.
Yeah. And see, some things you can't do anything about.
You can't.
About your children.
You can't. They're going to drive you crazy.
Yeah,
that's what they do.
So I guess it's how you handle
it. Is.
The stress.
It is. It's how you handle it, and then how, what do they say? Life is 90% of what happens to you, 10% of what happens to you, but 90% of how you react to it. So that's really where the stress reduction is going to come in, is how you react
and finding the right ways to handle your stress. Not drinking, smoking, or
exactly.
Maybe sleeping and exercise.
Getting your exercise, getting some sleep. Absolutely. Eating a healthy diet. When you eat better, you feel better, and then you have less stress. You know, when you eat cleaner, you feel better.
That's true.
Yeah,
That's
absolutely.
True.
Absolutely.
All right, so we've been talking to Dr. Nicole Edwards with Abundant Life Concierge. Now, Nicole, as we wrap up with you, tell us a little bit about your practice. We know that you were kind of going back to the days of house calls. So
I am.
Yeah,
so with
right.
concierge medicine, it is a specialized healthcare where we are at your convenience. It's a personalized healthcare as well when it's at your convenience. So we can do telemedicine, so online. We can do it over the phone. I can come to you, to your office, to your home, wherever's convenient for you. And it's not during the regular hours of 9 to 5 or 7 to 3. It's more convenient for you. So if you need an appointment in the evening, I can come to you in the evening. If you need an appointment on a weekend, I can come to you on a weekend.
That's great. Look, Sana Garrett's over there. I'm here. Yeah, I mean, that's good because the other thing that I love about it is a lot of times you don't want to go into the doctor where all the other sick people are.
Exactly, especially when other people are sick. You know, let's say you just have, a headache and then the person next to you has the flu and the other person on the other side of you has pneumonia and you walking out with a headache, flu, and pneumonia now. You know,
people pay for convenience too.
They do, and that's the main thing is the convenience. And so I understand when you're in a doctor's office, there's going to be some waiting. That's just the way life is. Emergencies happen, things happen, so there's going to be some waiting. But with personalized healthcare at your convenience, it's all about you, so there's no wait. You can call or you can schedule your appointment immediately. I can see you immediately. So it's
pay as you go?
You can pay as you go. You can pay as you go. I don't take insurance just because it's a lot of red tape, and so it's easier to just pay one price.
Right.
And then it's easier that way.
But people can call you. Give us your information.
So you can contact me at 803-543-2913.
543-2913.
Absolutely. Or you can go to pastorscare.com. That's PASTORSCARE.com, pastorscare.com, and you can schedule an appointment through pastorscare.com.
All right, 803-543-2913 or pastorscare.com, because briefly you also do some specialized programs for pastors and church ministries.
Absolutely, for pastors and ministers, because they're spending so much time taking care of everybody else, they don't have time to take care of themselves.
Absolutely. All right, Dr. Nicole Edwards, I love that. Abundant Life Concierge, 803-543-2913, pastorscare.com. Give her a call. She can give you more information about her personalized healthcare service and help you with this new blood pressure guidelines. But remember, exercise, stop drinking, eat clean, a little bit cleaner, no sodium. Also, get enough sleep, stop smoking, and reduce your stressors, and you'll be pretty good.
Absolutely.
Nicole, Abundant Life Concierge, 543-2913. Coming up next on the P.A. Bennett Show, it is the season for the holidays, but you also need to think about your taxes, because right after you spend all your money for the holidays, it's going to be tax time. So we're going to come back with Sana Garrett with DCT Tax. That's coming up next on the P.A. Bennett Show. I'm Trey Taylor.
Thank you. I need to be calling you.
Okay.
Because
I want to call you. So don't like convenience.
Well, good.
So you can do prescriptions?
I do prescriptions. I can do everything. The lady who called me this morning, she was dealing with the headache, and so I was able to see her. I could see her neck was all spasms on this side. I was like, so clearly you have tension headaches. So let me send you in something for tension headaches, and we'll schedule a follow up in a week. It's perfect for self-employed folks, for folks that have high deductible plans, because they haven't met their deductible. So that $200 to $400 doctor's appointment.
The Obamacare stuff, they even have insurance.
Exactly, and that's who I got. Well, I'm looking for somebody to do my taxes, because now that I'm self-employed, oh Lord. So I will be. Actually, that was on my list of things to do this week, is to get.
You work from home. You just travel out
to wherever I gotta go. Yep. But my main office.
You have a certain distance that you.
South Carolina. My license is in South Carolina. So no distance. I actually have an office that I use. I don't want to ever use it if I don't have to. But I do have an office. It's over off of 2 Notch. Yeah.
Right off of 2 miles. Near next to Rush's and Sandy.
Okay.
At WGCD.net.
It is the PA Bennett Show. I'm Trey Taylor. Thank you so much for joining us. We've been talking to Dr. Nicole with Abundant Life Concierge about the new blood pressure guidelines. Well, something that can raise your blood pressure is your taxes, but we're talking right now to Sonia Garrett with BCT Tax Service to kind of help people get ready for the 2018 tax season. Sonia, thank you so much for joining us. We appreciate you, beautiful.
Thank you. I'm glad to be here.
Absolutely. So people right now are really kind of in the holiday mode.
Yep.
People are thinking about what they're going to get for Christmas, what they're going to give for Christmas. But as soon as it's over, then people will kind of fly into tax time.
Yep.
But this is the time really kind of mixing in with your holidays that you need to be thinking about taxes. Is that correct?
Yes, and we recommend you prep year round, not just, okay, I got to get ready. Because,
Yeah.
you know, for us, tax season is cyclical. You know, you got
Yeah.
the people that rush in when it first starts, and then it dies back down in March. And then end of March, you jump back up going into the April time frame. But now is the time to really start preparing. You know, if you're getting ready to get ready, you know, you really don't have to, you don't have to prep if you're doing what you need to do year round.
Gotcha.
You just pretty much maintain.
So tell me some of the things right